So pretty much, like, doctor comes in and he's like, how's everything going? I'm like, I mean, I'm doing fine. My toe, on the other hand, is not really doing that fine, because I said I'm still not able to extend the toe. Like, I still can't extend the toe. I still can't curl the toe. And therefore, I can't do lunges. My running and walking gait is still a little bit altered because I can't push off. Another issue that happened, that I actually ended up getting an ingrown toenail, because apparently my distal phalanx, the very, very tip of the toe, is actually rotated. And maybe it was rotated before the surgery. I'm assuming it was. And so what happens is, being that my big toe can't push off forward, it rolls off because it has to get pushed off from somewhere. So it's going to get it from the little toes. So instead of walking here, I push off and my foot kind of rolls out to the side. So what ends up is the big toe ends up with a lot of pressure on that side, because the toe is like kind of rotated like this. So when I try to push off and it rolls off like this, that nail is just digging into that little bit of nail bed on the side of it. That was extremely painful for a couple of days, and I had to get my AT at work to pack it with cotton swabs, which was extremely painful, and I was limping the rest of the day. At it, he's like, does it just feel stiff? Does it da-da? And I'm like, yeah. I'm like, it just feels stiff. Like, I've been in physical therapy for my foot longer than my shoulder. Like, shoulder is fine now. So he feels like the issue may be that the two joints are impinged at the MTP joint, so the metatarsal bone, and I forgot what the one that is right above it. At that joint, he feels like they are impinging, and it could be because my metatarsal bone is slightly elevated up. So then when that joint tries to, it should slide against it. And what's happening is they're just like butting heads in there, and like it's getting to a point where it won't move, because like there's no like space between the joints, which kind of makes sense, because one of the exercises that we've been doing in physical therapy, I'll put a clip of it, is we've been kind of doing like a band distracted split squat to really force that toe into extension. So these are the split squats that I was talking about. And so as you can see, the band is essentially trying to pull back on the MTP joint, which should allow the bone to slide against the other bone and be able to allow me to get down into that split squat. But as you can see, it just does not bend at all. And the first time we did it, I felt like we were getting more range of motion out of the joint, which would make sense, because the point in the band distraction is to like pull the joint in the opposite direction to like allow it for that space to be created between it. So that would make sense if there's actually no space in between the joint. So I'm like, all right, well, boom. Okay, well, what do we do about that? Here this guy goes, well, we'd have to do another surgery. Totally lost me. I saw fucking red. Like, I was like, you gotta be fucking kidding me. One fucking toe, almost 5 months out, and you feel like you need to go back in? I'm so mad. I'm like, I'm so mad. He pretty much says that he would need to go in on that incision that is along the side. He wouldn't need to open up that big one up top, because he said everything's fine with the bone. The bone is healed, but he would need to go in alongside. And he said he would shave some of the bone up off the top. He would take care of some of the scar tissue, because he feels like the scar tissue could be playing a role in it. And he would also rotate my toe back to normal, back to, being on top, so that when I guess do get the range of motion, I push off, we don't have that issue with the toe rolling out to the side. Like, I had this surgery done third of the way into quarantine and the whole pandemic. I would have had it done earlier, but the hospitals and stuff were shut down for elective surgeries. So I'm just kind of like, the point was for me to be healed up and recovered, because my job is demanding. I'm on my feet, I'm active, and so I've already spent my 6 weeks in the boot. So then, I'm like, all right, well, okay, what's the recovery like if you got to go in there and slice and dice shit again? He's like, 3 to 6 weeks in the boot, depending on how the bone heals. No, I'm not fucking, I don't want him to go back in there. I don't know why this wasn't seen in the first place. Did you not test the joint to see if it moved? Is that not something that they do in surgery? I thought they are supposed to take the joint and move it through the range of motion, make sure everything's set, And I mean, I know, like, I talked to a couple people about this already today, and I know, they miss things in surgery, so it's not abnormal for sometimes them to have to go back in and fix shit. But I don't even have any fucking words, you know what I'm saying? I just don't even have any fucking words. So this is the amount of flexion that I have in the toe. It's a little bit swollen now. I've kind of been on it today. And this is my curling motion. This is approaching 5 months, and this is the range of motion that I have in the toe. It looks fine when you're just moving it around, but when you're walking, you need this toe to be able to come back more than that. And the range of motion here is fine. I can curl the toe passively, but I can't actively curl the toe. Then he's like, but I want you to get an MRI to make sure we rule out any, musculoskeletal things with the muscle, ligaments, tendons, whatever. I'm going to talk to my physical therapist this weekend and just see what their thoughts are. If they, think I should get a second opinion, does that make sense to them? Is it, have they worked with that type of, the patient who's had that type of procedure? I just want to get another expert's opinion on it. I don't know. I'll probably post another video. I'll probably record a video after I talk to my physical therapist Saturday. It is Saturday, October 3rd. I just left my physical therapy appointment and pretty much told them everything about the follow-up with my doctor and all of his little bullshit. And they were obviously frustrated too, because it's a really shitty situation, because we've been working on his toe for pretty much 5 months, and we have went through every resource and tried every technique, everything to get the toe to be able to work and everything. So they pretty much suggested that I definitely go get a second opinion. They gave me 2 names of doctors that are in the area that they have had good experiences with, that are, reliable, trustworthy, and do a good job. And I asked him, on a personal note, as far as with my doctor, with my surgeon, is this, because he's treated some of his other patients, and I'm like, have you heard anything from those patients about any type of complications like this, or any sort of negative feedback? And he said he hadn't heard any, as far as he knows. He's a good doctor and blah, blah, blah. But he did say that he feels like the situation with me should have been treated differently. Because after a certain point of realizing that the toe was not regaining the functionality that it should have had, it should have been a cause for more alert from the surgeon. And it wasn't. It was just well, let's give it a little bit more time. Well, let's walk on it for a bit. Well, let's run on it for a bit. And now we're here. And now it's well, we have to go back in. And, it could have been found out sooner rather than later. So I got the names of those 2 doctors. So I'm definitely going to give them a call next week and find time to get an appointment set up. They definitely think I should get the MRI, because regardless of what next step I take, I'm still going to need it, just so they can and whoever doctor surgeon can take a look and just check out the musculoskeletal stuff and everything. So they're the toe has come along, it has progressed, it just hasn't progressed to where you want it to be at, and that could be due to a joint restriction, which it seems like that's kind of what the doctor's saying, with the bones impinging each other and stuff. So see what the other doctor says, see if he thinks surgery is the only way. If there's anything else that I can do, then I'll definitely do that. Still pretty annoyed, just still fucking blown, just so fucking blown by this guy. And they said the same thing, is when you go in to do the surgery, you open somebody up, take care of everything, make sure that joint is moving right. If things heal up not as expected, things like that, that's just that happens sometimes. But as a surgeon, what you should be doing is making sure that joint is good to go. It shouldn't be, what's happening in my situation, to me, to them, should not have happened. He should have made sure all that shit was straight and taken care of before he sewed my ass back up. Yeah, I'm just kind of frustrated. I feel like he was just more focused on making sure that the bone was straight and that he had done the procedure properly and correctly, rather than thinking about the outcome and the functionality of the joint, which is what I very explicitly told him every time I spoke to him before the surgery, was that I wanted that joint to be able to move so I can run, lunge, and jump, not so I can look cute in a motherfucking flip-flop. Because that's the only fucking thing I can do now, is look cute with my fucking toes out. And don't really look that fucking cute because I got a big ass fucking scar. But whatever. I will follow up when I talk to the other doctor. Okay, so it's November 13th, and I just followed up with my original doctor to have him look through the MRI and get his perspective on what's going on with the foot. Before that, I got a second opinion from another orthopedic surgeon, local in the area. And that guy pretty much felt as though like scar tissue was playing a huge role in the toe not being able to move. It also felt like the hardware could be the issue. So his idea was to go in and remove all of the hardware and clear up the scar tissue. It's my understanding that the hardware is there to permanently hold my bones in the correct anatomical position to prevent the bunion from coming back. Why the fuck would you take out the fucking plate and screws? So I'm like, well, would the bunion come back? And he's like, no, the bunion wouldn't come back. I don't understand that. You know, I have a hard time understanding that. Now this guy I had a second opinion from, he does not do the exact type of procedure like the Lapiplasty. They have like some other medical term for it that I can't remember, but he does not do that exact procedure himself. He's familiar with it. He's like, okay, he went in and did a da da da. I don't really know if I trust him to be able to speak on a surgery that you don't yourself perform. That's not the way that he corrects bunions. So I don't really know if I trust you to be able to go in and look and say, okay, here's what we need to do, because that's really not your specialty. Is not that type of procedure. The original doctor I go to, that I've been going to, following up with, this is his specialty. Like, this is probably 85% of the surgeries he does is this specific type of procedure. I guess I trust him a little bit more to be able to give me an opinion on the outcome of this procedure and on complications that arise from it. I go in and we take a look at my MRI, and he pretty much said that he didn't see any like muscle damage, any tendon damage. All that was fine. Everything musculature wise looks fine in the foot. So he was like, you know, he wanted to rule that out. The last time I spoke to him, he was saying that he would need to go in and shave the bone down. He'd rotate the toe and he'd clear up the scar tissue. But he said that he would only need to go in on that small incision on the side of my foot, and that I would go immediately into a boot and I would be able to weight bear, and he would get me in PT within the week. I probably should have brought this up to him because I don't know if he remembers saying that. But today he pretty much gives me my two options. He's like, either I go in and just shave down the distal part of the metatarsal and, you know, do something to the toe, whatever, to clear up more space. He's like, or I pretty much go in and redo the same procedure, but not the same procedure because the bunion is fixed. But what he would need to do is go in, take the plate and screws out, shave down the top of the metatarsal bone, rotate my big toe and to allow the toe to slide against the metatarsal bone and just clear up more space in between there. Because what he feels like is when they went in to do the surgery, sometimes when they correct it, the metatarsal bone ends up being elevated, and that's why the toe is pinching into it. That's not what we discussed last time. I feel like I explicitly remember him saying that he would not need to mess with the big incision. He felt like that was the best option because the minimally invasive surgery where he just goes in on the side and just shaves down the top of the distal part of the metatarsal, he said that bone would grow back, and then because I'm young, that eventually I would end up with the same issue of the bones grown back and now it's still impinging. So then, whatever, 15 years down the road, here I am, need to have another surgery. So he's like, look, let's do this other one. It takes care of it for good. You don't have to worry about it. But I'm like, okay, if that's what you feel is best, what's the recovery time? So he said I would immediately go into the same boot that I just had, but he would have me on crutches or non-weight bearing for 3 weeks. 3 weeks in a boot, non-weight bearing. And a total of 6 to 8 weeks in the boot. He said plan on 8 weeks. So this is my option now. Essentially, it's get this surgery done and restart your recovery from square one. Now that I'm at 7 months, I'm literally exactly at 7 months because my surgery was on May 12th. I'm literally exactly at 7 months. So I restart my recovery all the way back over, square one, day one. Or I just say, fuck it and live with it. If I knew I was gonna have no range of motion in the joint and have pain in the joint or, you know, around the toe, I would just not had the fucking surgery because I had that shit before. I don't really want to go through the recovery again. I don't want to be in the boot for 8 weeks. And furthermore, how do I really know that this is the end all be all when he goes in? What if something else happens? Just wanted to update y'all. That's where I'm at 7 months post Lapiplasty procedure.